Hello everyone, it's Nurse D here, and in this video I'm going to be talking about COVID-19, aka coronavirus, and the types of signs and symptoms you need to look out for. And please stay tuned to the very end of this video because I have some bonus information at the end that will be very useful for you and your family members. To give you a little information about me, I'm a registered nurse and I've worked in the healthcare field for almost 20 years. When this pandemic broke out, I did go to New York, specifically Brooklyn, New York, and work at one of the hospitals. So I was interacting with a lot of COVID-19 positive patients that I had to treat. My background is ER nursing, and I also did work in the ICU while I was in that hospital as well. First, I want to share with you a little statistics. According to the CDC, right now in the United States, we've had about approximately 100,000 deaths with a recovery rate of 97%, meaning that the death rate is 3%. So this was previously put out when the outbreak first happened, as far as the statistics and data that was put out with the recovery rate and the death rate as well. However, the CDC currently, as of about 2 weeks ago, they put out new additional information about the death rate, which is significantly lower than previously reported. So the new death rate that the CDC has put out is at 0.4%, meaning that the recovery rate is now at 99.6%. So if you catch it, it's a 99.6% that you will survive it, and only a 0.4% that will become fatal for you. If you so happen to catch COVID-19, there is about a 30% chance that you won't have any type of symptoms, so you won't know you're, carrying the virus. Individuals that do end up catching the virus and they end up having symptoms, typically within 2 to 14 days after you've been infected with the virus, you will end up having symptoms. So that's why the CDC recommends for you to quarantine for about 14 days or 2 weeks, because that's during the time that you'll be infected, and then after that you should recover if it doesn't become a fatality. So some of the symptoms you want to look out for is a fever and chills. And a fever is considered any a temperature above 100.4. Cough, congestion, runny nose, any muscle aches, fatigue, tiredness, or increase in your fatigue and tiredness, loss of taste or smell, and nausea, vomiting, diarrhea, sore throat, or a headache can all be a sign that it's possible that you could have the virus. If you do have these type of signs and symptoms, there are lots of locations now where you can be tested if you choose to, or if you want to self-quarantine yourself at home for 14 days, that is perfectly okay. In addition, I also want to mention, please, please, please go to the emergency department if you have shortness of breath, difficulty breathing, chest pain, confusion that's new, any major alarming changes with yourself or your loved one. You definitely need to go to the emergency department to get checked out, to make sure you're stable enough to self-quarantine at home. Comment below if you've actually tested positive for the coronavirus, and share with us the type of signs and symptoms that you ended up having, because it could be a wide range of these different signs and symptoms that each individual experience or doesn't experience, and just let us know. Let's talk about quarantine. So if you end up being positive for the coronavirus, or you're having signs and symptoms and you want to self quarantine at home. So, first, if you live at home by yourself, it's going to be pretty easy. Stay in the house. If you have to have somebody to drop food off, don't have direct contact with that person, or if you order food, do that for 14 days. If you have other people living within your home, try to self isolate yourself within a room, and also try to have your own bathroom that nobody else within the house can use. If y'all have another bathroom that the other family members and stuff can use, do that, and you just use that specific bathroom so the virus is not being spread. If you need to have any type of interaction or conversation that you need to come out of your room to discuss with your children or your spouse or any other family members, make sure take these steps. So change into new fresh clothes, wear a mask, wash your hands, and do not touch your face when you're interacting with when you're outside of the room. And that will help cut down a possibility of spreading the virus outside of your area of contamination. And the last thing I want to share with you is a bonus. So, as you know, right now in the hospitals, they're not allowing any type of visitors, nobody, to come in to be with their loved one. So, make sure that you're calling every day, or the minimum every other day, to check up on your loved one. Call and talk to the nursing staff so they will know that they have a family member that cares for them and you are advocating for them. Every single day, they're drawing new labs, taking chest x-rays, different scans. So ask about those labs and x-rays and scans that's being done on your family member. Ask them specifically, is there any new abnormal results that you should know about? Ask them about the different treatments. What are y'all administering to my loved one to take care? For example, if they have an elevated white blood cell count, which means that it's elevated because they have an infection within their body, ask them what type of antibiotics that they're administering to your loved one. And when you call back the next time, ask, what the results are again for the abnormal result. For the white blood cell count, has the results decreased? Is it improving? If it's not, what are they doing? In addition to lab results, ask about the chest x-rays. Are there improvements from the last chest x-ray? If they done any additional scans or ultrasounds or anything else that you need to know, just make sure you're being very involved so the staff will know, because it's very difficult and a lot of things happen that you don't know. When family is there in person, it does make a difference in the type of care. It does. So if you call every day to check up on them so the nurses know that they have somebody that loves them and somebody is looking out for that patient, it will make them become extra cautious with that patient. In my next video, I'm going to be sharing with you how to decrease your chance from becoming a COVID-19 fatality. So subscribe so you don't miss out. And take care. Bye.